Our entry point to the project was the scenario from the first Messiah residency that was called Poetry of Nutrition. And it was about a realistic dystopian future set in around 2030, where global health crisis brings challenges, both mental and physical.
So one of the things I like most about the Messiah project is having that artist into R&D work. It's really an interesting idea. How can the artists provide and actually provide a lot of inspiration, creativity, but also knowledge into these R&D projects? Because if we try to look into what's going to be next for our society, I mean, a lot has come from watching movies and being used from that creative world. So that's been one of the most fun things about the project, I would say.
So with the help of Robin Jonsson, a skilled choreographer with a lot of experience in working with robotic and VR shows, we chose to combine our skills within social robotics to explore how an affordable robot could be used as a nutritional companion in the homes of solitary elderly.
So my name is Robin Jonsson. I'm a choreographer and director, and I'm specializing in using different kinds of advanced technologies in my artistic processes and performances.
So we're trying to use a very cheap platform to make it affordable for well, everyone. But still having a platform that has a good mic, has a good speaker, and that has as much as possible in the need of already talking to a robot.
But we also really work on the really sort of subtle specifics of the body and sort of how it moves, body postures, all of these things. I think this is really fundamental, and I think it's often overseen in robotics. And it might seem like a detail, but I think it matters so much because that is how we humans work.
So that was a really good start to the project. In the meantime, we could also start on the nutrition research side. We could start looking into what is the most important nutrition needs that we can help alone elderly with.
So we know that the population is aging and that a much larger part of the entire population is going to be elderly. And in this future scenario, they are the extra vulnerable, affected by factors like isolation, chronic illness, and especially psychological effects of long-time preventive quarantine measures that already witnessed during the COVID-19 pandemic.
So we implemented LLM and added both RAG and structured output to be able to make the robot say the food profile to them to make the robot assist. And then we have some different prompts for the different tasks the robot should do. And the last work package was more about user interaction. So how should the robot interact with the user, and what is required, and where should the robot be placed, and will it need to attract attention before actually starting a task or something. But also about user test and making sure that this is a product that someone wants to use.
Some of the elderly men we have talked with that have lost their spouse have experienced heightened challenges of knowing what to eat, knowing how to cook after their spouse was gone. We found a strong need of companionship, verbal interaction, being seen.
Here's where our robot can help, having different features like reminders, so the robot can remind the user of when to eat or take supplements or even medicine, or just to have that extra glass of water or eat the fruit. And also being a discussion partner of what to eat for lunch, knowing your food profile, knowing your allergies, and knowing if you like to try new foods or if you like your old favorites. And also being that conversation partner during the meals to make it less lonesome to eat by yourself.
So we see there's a lot of interesting interaction problems in the state that the technology and the LLM is today. There's a lot of challenges in verbal timing, knowing when the robot is done, the tone of voice, choice of language, words. But there's also considerations among the elderly, a distrust to technology, distrust to data collection, fear of data intrusion, of scams is a very big worry among the elderly.
This project has been very well fitting for us here at Dyno because we have experience working with social robotics, targeting different user groups. We worked a lot targeting kids, but this has really broadened our perspective of how social robots can be used. We see a big need within elderly care for assistance because there is a lack of personnel in that area. And there are stories where elderly people refuse to eat if there's no company during the meal and so on. So we really are interested in looking into how can robots assist us here. And we need to think a lot about where is that human interaction actually important and what tasks can be performed by a robot.